Hi, this is Paul Gordon. I'm the neurologist currently working in Shiprock, New Mexico.
What brought you to the Navajo Nation?
It's a complicated question. I've led a very fortunate life, and I wanted to spend time giving back some to more needy people. I'd spent a few years in Paris, and I thought that this would be a nice transition. I expected to stay a year and have liked the environment and the people, the colleagues so much that I've stayed 5 years.
And you may stay even longer.
Yeah, currently I don't have intentions to go elsewhere.
You recently turned your attention to ALS. What interested you to focus on this disease?
I've focused on ALS much of my career. I trained with Bud Rowland, and so was kind of brought up with ALS. I did a fellowship in ALS and led the ALS Center at the University of New Mexico for a number of years. I was the only ALS specialist in the state, and so saw patients from kind of all walks of life from all over, and was associate director at the Center at Columbia for a few years, and then did some ALS work in Paris where I got my PhD in epidemiologic aspects of ALS. And so it's always been kind of a focus of mine. I came out here and began to see diseases in different prevalence than I'm used to. There aren't many people. There's about 180,000 people that live on the Navajo Nation, and so ALS being a rare disorder, I don't see a lot of ALS, but I see a lot of other things. There's a great deal of Bell's palsy, quite a bit of Parkinson's disease, and a lot of epilepsy. But because ALS has always been a focus of mine, I thought it would be nice to at least examine it and try and report incidence and prevalence out here to begin with, which haven't been done before.
So to get at these questions, you chose to take a look at exactly how much neurodegenerative diseases you're seeing, and most recently ALS.
Yeah, right. I think that always part of the issue is just having people on the radar. American Indians, I think, are sort of overlooked in the country in terms of receiving adequate funding and adequate numbers of physicians. The IHS does a terrific job, but it's a difficult environment for a number of reasons. And so we wanted to begin by saying, look, these are issues. There's more out here than just diabetes. And so beginning to put the problem on the map, we wanted to start to define burden. And so we looked at Parkinson's disease and ALS first.
Your recent results suggest, I think, that ALS may be less common in Native Americans, particularly in the Northwest and the Southwest. Can you tell us why you think this could be the case?
Well, there's a number of explanations for why the rates appear lower generally. One is that the genetic background of American Indians may just pose different risks. The American Indians are thought to have come from Asia 14,000 years ago or so in several waves, and so probably share more in terms of a genetic risk with Asian populations than with Caucasian population in the United States, and also some suggestion that the rates may be lower for ALS in Asia than in Europe and the United States. And so that kind of fits, and maybe an explanation too for why we're seeing less stroke and more Parkinson's. It may just all come down to genetic risk, and it's likely too that there would be environmental influences. American Indians in the Southwest don't smoke very much, and cigarette tobacco exposure is one of the more clearly documented environmental risks for ALS. And I think lastly, it's entirely possible that we're just missing some patients. There's a number of explanations for why the rates appear lower.
Absolutely. And one of the ones that occurred to me is that our Native Americans are some of the most poor and underserved, and ALS could just simply just not be recognized or recognized too late.
I've thought quite a bit about that, and you have to say that it's possible. I'm ambivalent. You know, I see many, many patients from all over the reservation, and I see undiagnosed Parkinson's, but I haven't seen that with ALS. ALS is in a way more devastating, more remarkable. And so the patients I've seen have been referred to me, and the primary doctors may not have known it was ALS, but everybody kind of recognized there was a problem. And the other side of it is that I think the IHS is well respected here, provides very good care, even though, as you say, there may not be enough physicians. And so patients do come.
So it seems to me what I'm hearing is that, yes, there is a possibility of missing cases, but also that for whatever reason ALS may be more rare in these populations, and we can start to learn from them about how to combat the disease.
Yeah, I think that's absolutely right. I think there's two sides to it, that people here need help. There's one neurologist here in Shiprock and one or two elsewhere on the reservation. People are underserved, and so part of looking into the diseases are just to define them for people. We're creating educational brochures and trying to meet standard of care guidelines. People simply knowing about illness, knowing about different types of neurologic illness and symptoms and so forth, I think mean that they will be more likely to seek care, that diagnoses will be made more accurately, and people then more likely to be treated on a par with elsewhere in the country, which can extend life, improve quality of life. The flip side of it is, from a research standpoint, we well know that in other disorders, treatment may need to be population dependent, and so treatment needs to be tailored, and I think that this will be even more the case as we begin to understand more of the genetics underlying different disorders. And so we need to begin to define illness. Maybe ALS is different out here. Maybe it comes with a different proportion of site of onset. Maybe it comes with different causes than in other populations, and so might need to be treated differently. Maybe gastrostomy or ventilation interventions would need to be considered in a different context. And an extension of that is that unique populations likely have unique or different causes, and so we could learn more about the illness by examining environmental and genetic risk factors in populations that haven't been studied before. Still, as everyone very well knows, a mysterious, difficult illness, and so looking at it from a different viewpoint could help.
It seems to me also, in thinking about this, if we do learn that the disease does appear to be more rare, it could also tell us something about how we can better protect people from ALS. Maybe that there is some sort of natural mechanisms that our bodies use to fend off disease, that for whatever reason they are better able to manage the disease.
Boy, it's a fantastic question and not an easy one to kind of comprehend. But you're absolutely right. I mean, if you know the recent evidence suggesting that misfolded protein can aggregate and spread in a way that's similar to spread of prions raises a whole different way of thinking about limiting spread of the disease. And so, yeah, maybe genetic influences in terms of immune function or diet or not smoking cigarettes are different. And so triggers for the disease might be less, or spread of the disease could be slower. You know, there's another reason that's kind of straightforward that is a possible explanation for why we see less, and that's simply that the life expectancy is less here. It's about 5 years lower than for the general U.S. population, which I think doesn't sound like a lot, but it translates into meaningfully fewer people who reach the age who are at risk for ALS, so 50s and above, 60s and above. And so I think that could translate into having fewer cases of ALS.
Thinking about all of what we've talked about, what are you planning to do next to follow up these observations?
Well, the next step, I think, is to try and delve into the numbers a little bit more deeply. I'd like to begin to examine rates in individual tribes. Different American Indian people may have different risks also. The main initial point, I think, would be to look at and to confirm the numbers by looking more locally and confirming with chart review so that we can examine the numbers we saw nationwide from a different perspective. And then I think an extension of that would be to begin with case control studies and begin examining whether there's a familial aggregation of different neurodegenerative disorders and begin to examine environmental risks.
Absolutely, which is of course a huge challenge where you are.
Yeah.
So you're thinking then that we can learn a lot from everyone with this disease. We may discover new genes that may tell us more about ALS. We may get a sense from these communities of whether or not there are certain environmental factors that may trigger the disease, or certain lifestyle decisions that may either be helpful or hurtful. But what I think is also potentially particularly interesting is there's also that possibility that there may just be less of that disease. And what that could tell us to help combat the disease is also invaluable.
Yes, that's absolutely right. That, you know, there's just a number of issues that need to be accomplished here. I've traveled around so much, I've kind of learned that everybody is, in a way, the same, that we all want good health and good medical care, and I think in some ways the American Indians are kind of flying below the radar, and just helping people out here I think would be one goal that we could accomplish. But then their ability to give back to the country also from their unique vantage point, both in terms of genetic and environmental and cultural influences, could provide clues that are missing in a way for defining etiology from a genetic standpoint or from an environmental standpoint, or maybe defining influences that impact disease progression. So I see it as a win-win, both for the people and for the ALS field as a whole.